Respected researchers present here during my lecture. I'm Dr. Janaina Rodrigues, Medical Assistant Otorhinolaryngologist at Federal University of São Paulo. My research was performed at School of Medicine of University of São Paulo, Brazil. I'm glad to share it in this global conference, and I would like to thank you for this opportunity.
The title of this study is New Insights of the Effects of TNF-alpha Blockade by Gene Silence in Noise-Induced Hearing Loss. And why to study this topic? Exposure to noise is one of the most common causes of hearing loss. The World Health Organization estimates that 1.1 billion young people are at risk of noise-induced hearing loss due to the association of occupational with recreational noise, especially in loud concerts, sports events, and as well during the increasing use of headphones. Studies have demonstrated that inflammatory response may also be involved in cochlear noise damage. It was found not only that the cytokines levels were increased after noise exposure, but also that the blockade of certain cytokines, such as tumor necrosis factors alpha, TNF-alpha, was able to preserve hearing. The noise exposure promotes mechanical and metabolic damage that can lead to the degeneration of cochlear structures, such as hair cells, support cells, and afferent fibers of the cochlear nerve. TNF-alpha is a classical pro-inflammatory cytokine released by fibroblasts of spiral ligament, outer ciliary cells, and support cells into the cochlea after injuries, especially noise exposure. The cytokine interacts with the receptor and could lead to apoptosis by extrinsic cell death pathway in auditory hair cells. Gene silence is a genetic regulatory mechanism that activates a sequence-specific RNA degradation process that promotes the partial and temporary knockdown of the protein and permits to identify the action of this protein in a metabolic pathway. Therefore, we aim to investigate the effect of TNF-alpha gene silencing in the expression profile related to TNF-alpha metabolic pathway and in hearing through the analysis of the auditory brainstem response click parameters on the experimental model of noise-induced hearing loss. For this research, many materials were required. Animal model was young male with rats with normal praise reflex and with threshold shift on ABR clicks about 50 decibels. All procedures were approved by University of São Paulo, Brazil. The animal ears were randomly assigned to receive transtympanic application of gene silence against TNF-alpha, and the contralateral ear became a negative control receiving the scramble. The auditory assessment was performed by the auditory brainstem response evoked by click under isoflurane anesthesia in a sound attenuation chamber using TDT system. This exam involves short latency evoked neural potential generated in response to an acoustic stimulus and are measured using electrodes on the skin surface. We analyze the threshold, wave amplitude, and latency. In this animal model, studies have shown that wave 2 must be considered to settle the threshold. Thus, the threshold was the lowest intensity at which wave 2 was present. It was done before gene silence and 1 day after noise exposure. The transtympanic injection was done under anesthesia. We made an incision in the external auditory canal to visualize the tympanic membrane under a microscope. After that, we made an incision in the anterior region of pars stens to allow air evacuation during the injection. After that, 10 microliters from siRNA solution were gently and directly injected in the posterior region of pars flask without transfection agent. The animals were placed awake in a wire cage inside a box with free access to water and food. The applied stimulus were high-frequency white noise at a sound intensity of 120 decibels for 3 hours, through loudspeakers positioned in the upper part of the box above the animal's cage. 1 day after noise exposure, the animals were decapitated and their bulla was removed and opened. The membranous cochlea was isolated and the RNA was obtained and converted to cDNA according to the manufacturer's protocol. QRT-PCR was then conducted using Tegman array fast plates with TNF-alpha metabolic pathway genes according to the manufacturer's protocol. To validate the silencer, in vitro silence analysis with high-content screen was conducted. Glial fibroblast cells from rats were used. 2 independent experiment sessions were carried out, both in triplicate with TNF-alpha protein staying green. 9 sites per L and 3 wells per treatment were analyzed. The presence of the protein was determined using Image Express, and TNF-alpha positive cells were determined using the Meta-Express software. Statistical difference in the values of protein labeling were obtained using these statistical methods with a significant level of 5%. For gene analysis, we consider the fold change, and in order to determine the increasing or decreasing expression, we use this cutoff. The silence rate was calculated using this formula according to the manufacturer's protocol. For the analysis of the ABR data, we use this statistical test to compare the years that received the TNF-alpha silencer or scramble. Regarding the fold change, when TNF-alpha expression had decreased, we could observe an upregulation in genes involved with cell-survival pathway, especially PAC1, and a downregulation in genes involved with cell death. To improve the understanding of genes evaluated in this study, this table shows these genes grouped in their respective families. Fold change demonstrated here was obtained after noise exposure and after silencing. It's important to observe that TNF-alpha has increased after noise and decreased after gene silence. In the same way, the TNF-alpha receptors with death domain and other genes involved in apoptosis has increased after noise exposure and decreased after silencing. This is the image of in vitro silencer validation. When the scramble was used, a high cell fluorescence was observed in A. However, the silencer administration led to significantly decreased fluorescence with a silence rate of 96%. This is the ABR click from an animal. In this case, left ear was being silenced, and we could observe that there is a difference between before and after noise exposure related to threshold or wave amplitude. The opposite was observed in the right ear in the same animal. In this case, before noise exposure, threshold was 14 decibels, but after the noise it switches to 90, that represents a severe hearing loss. At 90 and 80 decibels, because it was the threshold present in all animals in this study, we evaluated the wave amplitudes and could observe the significant change in all silenced ears, mainly in wave 1 at 90 decibels. This data is important because the decrease in the amplitude, especially in wave 1, reflects an injury in the synapses between the hair cells and the auditory nerve called synaptopathy. In this study, we were able to demonstrate for the first time that the blockade of TNF-alpha through gene silence could protect hearing from noise-induced hearing loss. TNF-alpha is a pro-inflammatory cytokine that can induce auditory hair cells apoptosis through the extrinsic cell death pathway. Our results showed a significant upregulation of anti-apoptotic genes as well as a downregulation of pro-apoptotic genes in the cochlea of ears submitted to TNF-alpha blockade by gene silence. Likewise, other studies have shown that not only drugs against TNF-alpha but also antioxidants and GNK inhibitors, which can act in a different stage of apoptosis, could protect the hearing for noise-induced hearing loss. The transtympanic injection was able to reduce the TNF-alpha gene expression to 26.31%, with a silence rate of 74.1%. In the same manner, in this study, the intratympanic injection was able to reduce gene expression to 30%. and the silence rate observed in these studies was about 70%. Changes in the amplitude and morphology of the waves at the ABR click represent the cochlear lesion induced by noise exposure without silence. In the same way, this study demonstrates that the amplitudes assessed by ABR in rats after noise exposure show a significant change. Similar to our findings, Stamper and Johnson observed a decrease in the wave 1 amplitude at ABR click in humans after noise exposure. These authors report that decrease in wave 1 amplitude corresponds to the persistent loss of synaptic connections between hair cells and the auditory nerve, which characterizes synaptopathy. In our study, even without complete hearing loss in the negative control ears, the decrease in the amplitude of wave 1 observed suggests a cochlear injury, which was not observed in the silenced ear. Taken together, our results reinforce the previous observation that TNF-alpha has an essential role in noise-induced hearing loss and allows us to suggest that the blockade of TNF-alpha by gene silence was useful to prevent noise-induced hearing loss. At last, to conclude my lecture, I would like to share the limitation of this study that was a lack of results showing the quantity of TNF-alpha protein. However, we believe that our results can motivate and guide other scientists to develop further studies. This is Dr. Janaina Rodrigues, and I would like to thank you all for your patient listen. Thank you.